Good evening, and I just, as we're here to talk about loneliness, I just want to, acknowledge all of my friends here. It's great to be surrounded by a lot of familiar faces. I want to thank you all for joining us this evening. We're here to talk about loneliness, and it's obviously, I think, for all the reasons you just heard, a very timely discussion. But I want to remind you all that loneliness is not a new topic. It's really as old as humanity is. But I think that there's been an undeniable acceleration in how much loneliness we've had in our society. And, Robert Putnam, as early as 2001, told us about the coming wave and coming epidemic of loneliness. He called it a decline in social capital, but he nonetheless warned us that this was going to happen. His colleague at Harvard, K. Anthony Appiah, warned us about what he called an epidemic in plain sight, noting that people are lonely. We all know that they're lonely. We know it's a problem, but as a society, we're doing very little about it. And so you may be wondering why a health system like CareMore is interested in this topic, why we're underwriting an event like this. And the answer is very simple. We know that there is a very strong connection between one's sense of togetherness, one's sense of connection to other people, and their own health and well-being. People who feel connected to one another tend to take care of themselves more. They tend to have other people in their lives who actually care about them. And as a result, their health outcomes are actually better when they feel more connected to society and more connected to their community. And so we've made this an area of great focus for us at CareMore. We've appointed a Chief Togetherness Officer, Robin Caruso, seated right here. We've actually built what I believe is the first clinical program in the world focused on identifying lonely seniors and then actually connecting them to resources in the community, as well as individuals who outreach to them regularly to express care and concern for them. And over 1,000 patients have now benefited from participation in our togetherness initiatives. And we're seeing an improvement in their health outcomes. We're seeing an improvement in their levels of engagement and participation in their community. What I always find remarkable about this problem is that it doesn't require us to pioneer a new medical treatment. It doesn't require us to invent a new drug in a lab. This is a problem that every one of us can actually help solve if we just decided to, if we actually created a social awareness of it, and then frankly created momentum around actually connecting people. And so this is something that each one of you has the ability to actually walk out of here today and make a difference to someone who needs connection, who needs a treatment for their loneliness. So what I'm really asking you to do is to call your moms and dads, call your grandparents, call your kids if you feel like they might be lonely, because this is an epidemic that knows no age bounds, it knows no race bounds, it knows no socioeconomic bounds. This is something that is prevalent across all classes and groups in American society, and something that I think we all have a collective obligation to begin to make a dent in solving. My hope for this discussion today is that it's not another conversation about defining the problem, because I will tell you there are academics who've gained tenure many times over for having defined the problem. There are journalists who've written about it. It's been documented. We all know that this is a problem. We've all either experienced it or know people who've experienced it. My hope is that tonight will be a conversation about solutions. And the reason I hope that is because there are people who literally need these solutions today. Robin Caruso, our Chief Togetherness Officer, frequently tells the story of calling a patient at home and the patient says, "Hello, Robin." And the answer, she said, "How do you know it was me calling?" And the answer is, "You're the only person who calls me." And so, my push to every single one of you is to think about how you can be part of the solution. And I'm really excited about the dialogue this evening, and especially excited about our keynote speaker, Dr. Vivek Murthy. He and I spent the last hour catching up and feeling less lonely together. So appreciate it. Thank you.